going to go to our next speaker, which is Rory Leeks. She is a health insurance specialist with local engagement and administration for the Office of Program Operations and Local Engagement in the Kansas City Regional Office. She began her career with the Centers for Medicare and Medicaid Services, or CMS, in 2017. Rory has transitioned into her current role with Outreach, which provides information needed to make informed decisions about CMS programs through education training with partners, stakeholders, and healthcare providers. So, Rory, thank you so much for joining us today. Are you able to go on camera and unmute yourself?
Yeah, I'm on camera and I've unmuted myself already.
Great.
So,
Good morning.
Good morning. I'm so glad that everyone is here today and you all could join. I know we want to get this important information out for you guys. And so just like Stephanie was saying, I'm just going to go over just the basics of Medicare, because as we all know, it's very in-depth, and you want to get in there and get this information. So any question that I can answer, I will absolutely do it. And then if I don't know anything, then I'll do exactly like Stephanie and David did. I'll find out for you and answer those questions, get those questions answered, and then make sure that Stephanie has all the information and just answer it directly that way, written. So with that, I will go ahead and I guess can I share my screen, Stephanie?
Yes,
Okay.
Please do.
Thank you.
Yeah.
Okay. Change the view on here.
I'll let you know whenever we can all see it as well.
Okay. Hold on for a second. I'll go full screen first. There we go.
All right. Yep, we can see it, and you can go ahead and start the presentation.
Okay.
All right. Great.
So we're getting started with Medicare. So this is just a disclaimer. This information is current at the time of the presentation, but because Medicare policy is subject to change, the contents of this document do not have the force to effect and effect of law and are not meant to bind the public in any way unless specifically incorporated into a contract. This document is intended only to provide clarity to the public regarding existing requirements under the law. This communication was printed, published, or produced and disseminated at U.S. taxpayer expense. This publication is a general summary that explains certain aspects of the Medicare, Medicaid, CHIP, and Marketplace programs, but is not a legal document. The official program provisions are contained in the relevant laws, regulations, and rulings. The Centers for Medicare and Medicaid policy changes frequently, and links to source documents have been provided within the document for your reference. At the end of this session, you'll be able to compare the parts of Medicare and coverage options, explain benefits and costs, compare original Medicare and Medicare Advantage, discuss how Medicare supplement insurance or Medigap policies and Medicare Advantage plans are different, describe the healthcare insurance marketplace and what people nearing Medicare eligibility need to know, describe programs for people with limited income resources. So health insurance for people, this is for the Medicare is 65 and older, under 65, with certain disabilities like ALS, also called Lou Gehrig's disease, without a waiting period, and any age end-stage renal disease or ESRD. And please note, to get Medicare, you must be a U.S. citizen or lawfully present in the United States, must reside in the U.S. for 5 continuous years. What agencies are responsible for Medicare? Social Security, which you just heard, the Railroad Retirement Board, or RRB, the Office of Personnel Management, or OMP, and CMS, the Centers for Medicare and Medicaid Services. What are the parts of Medicare? So in Medicare, we have Part A, the hospital insurance, Part B, the medical insurance, and Part D, the drug coverage. Your Medicare options are Part A, this is original Medicare, Part A, Part B, you can add Part D, and you can also add supplemental coverage. So this includes Medicare Supplement Insurance or Medigap, or you can use coverage from a former employer. The other options, Medicare Advantage, also known as Part C, has Part A, Part B, Part D. Most plans include Part D. And then there are some extra benefits under Part C also, and some plans also include out-of-pocket costs. So automatic enrollment for Part A and Part B. Enrollment is automatic for people who get Social Security benefits and railroad benefits. So you want to look for your Get Ready for Medicare package, which is mailed 3 months before. Now, I know this one says 2022, but don't pay attention to that. Of course, the books now have 2023 on them. So they are mailed 3 months before you turn 65, the 25th month of disability or the 25th month of disability benefits, and includes your Medicare card. Some people must take action to enroll in Medicare. To apply for Medicare 3 months before you turn 65, contact Social Security, which you just heard all about. If you retire from a railroad, contact your local railroad retirement board, and there's the number there. And please note, the age for full Social Security retirement benefits is increasing. Medicare eligibility age is still 65. So here's a copy of what the Medicare card would look like. It shows the type of Medicare coverage, Part A and or Part B. You have, and the date that your coverage started. To accept Part B, keep your card and carry it when you're away from home. To refuse Part B, follow the instructions in the Get Ready for Medicare package. And if you ever need a replacement card, you can visit the medicare.gov/account to log into your secure Medicare account and print off an official copy. Or you can also call the 1-800-Medicare number. So the monthly Part B standard premium, income related, adjusted amount for 2023, it's also called IRMA. If your yearly income in 21 for what you pay in 2023 was filed under individual tax return, 97,000 or less, above 97,000 up to 123,000, above 123,000 up to 153,000, above 153,000 up to 183,000, above 183,000 and less than 500,000, or 500,000 or above. So here's the individual, the joint tax return, if you filed married and separate tax return. So for the individual paying the 97,000, you would pay each month in 2023 $164.90. Again, if it's above the 97,000, then you would pay $230.80. If it's above 123,000 up to 153,000, you pay the $329, and then 153,000 up to 183,000 for $28.60, and then above 183,000 and less than 500,000, it would be $527.50, and then 500,000 or above would be $560.50 per month. So then we go to, if you file jointly, and then we have the 194,000, that would fall under that 164.90, 194 to 246 would be 230.80, above 246,000 to 306,000 It would be $329.70, and above 306,000 to 366,000 for 2860, above 366,000 and less than 750,000, 527.50, and then 750,000 or above would be 560.50. And then you would go into the filed married and separate tax return. Again, the 97,000 or less is the 164.90, 194,000 to 246,000. I'm sorry, 97,000 to 123,000 is not applicable for filing married and separate tax return. It's the 123 up to 153,000 is not applicable for the filing married and separate tax return. But you can see the prices, and that one would be $329.70. And then above 153,000 to 183,000 is not applicable for married and separate tax return, but the month that you would pay is $428.60. Above 183,000 and less than 500,000, above 97,000 and less than 403,000 for filed married and separate tax return, and then you'd pay $527.50, and then the 500,000 or above is $560.50. So that gets a little detailed in there, and so this is actually going to be posted on you guys' website also, so you'll have all of this information at your fingertips. The Consolidated Appropriations Act of 2021 Medicare provisions, it's beneficiary enrollment simplification. So they kind of simplified the enrollment process. It created us to be able to waive Medicare coinsurance for certain colorectal cancer screening tests. This Appropriations Act expanded access to mental health services furnished through telehealth. It extended coverage of immunosuppressive drugs for kidney transplant patients and other renal dialysis provisions. And the beneficiary enrollment simplification process, beginning January 1, 2023, Medicare coverage is effective sooner for individuals enrolling in the last 3 months of their initial enrollment period, or IEP, or in the general enrollment period, which is GEP. Coverage for these individuals is effective the month after their month of enrollment. There are also technical changes to the calculation for Medicare late enrollment penalties. Special enrollment periods, or SEPs, with no late enrollment penalties are established for individuals who meet exceptional conditions specified by the United States Department of Health and Human Services Secretary. So the beneficiary enrollment simplification, the new special enrollment periods, or SEP, the special enrollment period, individual or individual authorized representative, legal guardian, or caregiver was impacted by a disaster or emergency. It occurs from the day the federal, state, or local government declares the emergency or disaster, or the date in that declaration, whichever is earlier. And it ends 6 months after, whichever of these happens later. The end date in the original declaration, the last day of any extensions to the declaration, the date the government revokes or announces the end of the declaration, and then the coverage starts the month after enrollment is submitted. Beneficiary enrollment simplification, the new enrollment periods continued. This is special enrollment period, a health plan or employer error, formerly incarcerated individuals fall under the special enrollment period, termination of Medicaid coverage, and then other exceptional conditions. And it occurs from the day the individual notifies Social Security that the health plan or employer misrepresented or provided incorrect information. And this is for the health plan or the employer error. It ends 6 months after the individual notifies Social Security, and then the coverage starts the month after enrollment. For formerly incarcerated individuals, it occurs the day the individual is released from incarceration. It ends the last day of the 12th month after the month the individual is released. And then the coverage starts the month after enrollment, or the individual can choose retroactive back to their release date, not to exceed 6 months though. And then if there was termination of Medicaid coverage, the day the individual, this occurs on the day the individual is notified that Medicaid coverage is ending, ends 6 months after Medicaid coverage ends, and the coverage starts the month after enrollment, unless the individual elects a start date of the first day of the month they lost Medicaid and agrees to pay all prior premiums. Other exceptional, and this little bar is in my way, I can't see this, but there are other exceptional conditions once it occurs when Social Security decides whether the individual qualifies for SEP. It ends minimum 6 month duration, and then the coverage starts the month after enrollment. So the yearly open enrollment period, or OEP, for people with Medicare, it starts October 15th, and it continues in November and then ends December 7th. And then coverage would begin January 1. 7-week period. Each year you can enroll, disenroll, switch Medicare Advantage plans or Medicare drug plans. This is the time to review the health and drug plan choices. Medicare Advantage open enrollment period. This one actually starts January 1, continues through February, and ends March 31st. Or month 1, month 2, or month 3. And this is for newly eligible Medicare Advantage open enrollment. So the annual Medicare Advantage OEP is January 1st through March 31st. The newly eligible Medicare Advantage open enrollment is the first 3 months of entitlement to Medicare Part A and Part B. And you can switch to another Medicare Advantage plan with or without drug coverage during this period. You can also drop your Medicare Advantage plan and return to original Medicare. If you do, you can enroll in a Medicare drug plan, and then coverage begins the first of the month after you enroll in that plan. Please know that you need to be in a Medicare Advantage plan to use this enrollment period. So there's 5-star special enrollment period, or SEP. You can switch to 5-star Medicare Advantage plan with or without drug coverage or a drug plan. You can enroll once per year from December 8th through November 30th. And then you want to keep in mind that the new plan starts the first day of the month after you've enrolled. Star ratings assigned in October and effective January 1. So other special enrollment periods, you may have an SEP or special enrollment period if you move out of your plan service area, if you are in a plan that leaves Medicare or reduces its service area, if you need to lose or have a change in dual LIS eligibility status, and you're sent you are sent a retroactive notice of Medicare entitlement. If you leave or lose an employer or union coverage, have Medicaid and Medicare, or qualify for low income subsidy or LIS, if you enter, live at, or leave a long-term care facility like a nursing home. Part A, which is hospital insurance, covers inpatient care in a hospital, including a semi-private room, meals, general nursing, drugs, including methadone to treat an opioid use disorder, other hospital services and supplies, inpatient care in a skilled nursing facility or SNF after a related 3-day inpatient hospital stay. Part A, help covers, this is a continuation, blood, inpatient, hospice care, home health, inpatient care in a religious, non-medical healthcare institution. And then for paying for Part A, most people do not pay a premium for Part A, but if you or your spouse paid FICA taxes for at least 10 years, you get Part A without paying a premium. You may have a penalty if you don't enroll when you're first eligible for Part A, if you have to buy it. Your monthly premium may go up 10%. You'll have to pay the higher premium for twice the number of years you could have had Part A, but didn't sign up. What you pay in original Medicare in 2023, the hospital inpatient stay has a $1,600 deductible for each benefit period. Days 1 through 60 is zero coinsurance for each benefit period. Days 61 through 90 is $400 coinsurance per day of each benefit period. Days 91 and beyond has $800 coinsurance for each lifetime reserve day after day 90 for each benefit period, up to 60 days over your lifetime. And beyond lifetime reserve days would pay all costs. And please note that you pay for private duty nursing, a television, or a phone in your room. You would have to pay for a private room unless it's medically necessary. For mental health inpatient stay, it's also the $1,600 deductible for each benefit period. Days 1 through 60, zero coinsurance per day for each benefit period. Days 61 through 90 is $400 coinsurance per day for each benefit period. Days 91 and beyond is $800 coinsurance per each lifetime reserve day after day 90 for each benefit period, up to 60 days over your lifetime. Beyond lifetime reserve days is paid at all cost. 20% of the Medicare approved amount for mental health services you get from doctors and other providers while you're a hospital inpatient. There's no limit to the number of benefit periods you can have when you get mental health care in a general hospital. You can also have multiple benefit periods when you get care in a psychiatric hospital. Remember, there's a lifetime limit of 190 days. So what you pay in original Medicare in 2023, this is continued, the skilled nursing facility or SNF stay. Days 1 through 20 is zero for each benefit period. Days 21 through 100 is $200 coinsurance per day for each benefit period. Days 101 and beyond, that would be all costs. And then home health care is zero for home health care services and 20% of the Medicare approved amount for durable medical equipment or DME. Hospice care, you pay zero for hospice care. You may need to pay a copayment of no more than $5 for each drug and other similar products for pain relief and symptom control while you're at home. In the rare case that your drug isn't covered by the hospice benefit, your hospice provider should contact your Medicare drug plan to see if it's covered under the Medicare drug coverage, which is Part D. You may need to pay 5% of the Medicare approved amount for inpatient respite care. Medicare doesn't cover your room and board when you get hospice care in your home or another facility where you live, like a nursing home. And then there's blood, and if the hospital gets it from a blood bank at no charge, you will have no charge. If the hospital has to buy the blood for you, you must either pay the hospital costs for the first 3 units of blood you get in a calendar year, or have the blood donated by you or someone else. Benefit periods in original Medicare. Each benefit period, the benefits periods can span across calendar years. So each benefit period begins the day you first get inpatient care in a hospital or skilled nursing facility, and it ends after being home for 60 days in a row, not in a hospital or a skilled nursing facility. You pay Part A deductible for each benefit period, and there's no limit to the number of benefit periods that you can have. Medicare Part B, this is the medical insurance continued. Under there we have doctor's services, outpatient medical and surgical services and supplies, clinical lab tests, durable medical equipment, DME, like walkers and wheelchairs, diabetic testing equipment and supplies, preventative services like flu shots and a yearly wellness visit, home health care, medically necessary outpatient physical and occupational therapy and speech language pathology services, outpatient mental health care services are covered also. And then the Part B preventative services that are covered, this is a long list. It's abdominal aortic aneurysm screening for alcohol misuse, bone mass, cardiovascular behavioral therapy, disease screenings, cervical and vaginal cancer screenings, colorectal screenings, counseling to prevent tobacco use, depression screenings, diabetes screenings, diabetes self-management training, flu shots, glaucoma test, hepatitis B virus infection screening, hepatitis C screening tests, HIV, lung cancer, mammograms, Medicare diabetes prevention program, nutrition therapy services, obesity, behavioral therapy, pneumococcal shots, prostate cancer screening, sexually transmitted disease, and welcome to Medicare preventative visit, and then a yearly wellness visit. Those are all covered. What's not covered by Part A and Part B, some of the items and services that Part A and Part B do not cover, most dental care, vision for prescription glasses, dentures, cosmetic surgery, massage therapy, routine physical exams, hearing aids, and exams for fitting them, long-term care, concierge care, covered items or services you get from an opt-out doctor or other provider. Now, they may be covered if you have other coverage like Medicaid or a Medicare Advantage plan that covers these types of services. So what you pay in 2023, Part B monthly premium, the standard premium, as we discussed before, is $164.90. Some people who get Social Security benefits pay less due to the statutory hold harmless provision. Your premium may be higher if you didn't choose Part B when you first became eligible, or if your income exceeds a certain threshold. What you pay in original Medicare in 2023, your yearly deductible is $226. coinsurance for Part B services, 20% for most covered services like doctor's services and some preventative services if provider accepts assignment. It's 0 for most preventative services, and then 20% for outpatient mental health services and co-payments for hospital services. Please note that if you can't afford to pay these costs, there are programs that may help. These programs will be discussed a little later. So when you must have Part A and Part B. To buy a Medicare supplement insurance policy or Medigap, to join a Medicare Advantage plan, to be eligible for TRICARE for Life or TFL, eligible for civilian health and medical program of the Department of Veterans Affairs or CHAMP VA, and then employer coverage requires you to have it. And that employer has fewer than 20 employees. Medicare Advantage plans or Part C is Part A, Part B, and most plans include Part D with some extra benefits and lower out-of-pocket costs. Another way to get your Medicare Part A hospital insurance and Part B medical insurance coverage. It's offered by Medicare-approved private companies that must follow rules that are set by Medicare. Most Medicare Advantage plans include drug coverage, which is Part D. Coverage of Part D, in most cases, you'll need to use healthcare providers who participate in the plan's network. Some plans will offer the out-of-network coverage. Now, how Medicare Advantage plans work. In a Medicare Advantage plan, you are still in Medicare with all rights and protections. You still get services covered by Part A and Part B. You cannot be charged more than original Medicare for certain services like chemotherapy, dialysis, and skilled nursing facility care. You may choose a plan that includes drug coverage and or extra benefits like vision, dental, or fitness and wellness benefits. And you can be charged different out-of-pocket costs. In a Medicare Advantage plan, each plan has a service area in which its enrollees must live. You or a provider acting on your behalf can request to see if an item or service will be covered by the plan in advance, called an organization determination. Medicare pays for a fixed amount for your coverage each month to the companies offering Medicare Advantage plans. Each plan can charge different out-of-pocket costs and have different rules for how you get services, which can change each year. And hospice care is covered, but by original Medicare. How do I enroll in a Medicare Advantage plan? You can call Medicare at 1-800-MEDICARE. You can find health and drug plans at medicare.gov/plan-compare. And once you understand the plan's rules and costs, here's how you join. You visit the plan's website to see if you can join online. Fill out a paper enrollment form or call the plan you want to join. And again, visit medicare.gov/plan-compare to get your plan's contact information. Or you can just call Medicare directly at the 1-800-MEDICARE phone number. Now, Medigap policies are sold by private insurance companies. They actually fill in gaps in original Medicare coverage, like co-payments, co-insurance, and deductibles. Each standardized Medigap policy under the same plan letter must offer the same basic benefits no matter who sells it. And it may vary in costs. Plans are different in Minnesota, Massachusetts, and Wisconsin. How are Medigap policies and Medicare Advantage plans different? Medigap policies are offered by private insurance companies, and Medicare Advantage plans are also offered by private insurance companies. Government oversight for Medigap is through the state, but must also follow federal laws. For Medicare Advantage plans, it's federal plans must be approved by Medicare. It works with original Medicare for under the Medigap policies, and then under Medicare Advantage plans, it's not applicable. And the Medigap policies covers gaps in original Medicare coverage, like deductibles, coinsurance, and copayments for Medicare coverage services. And then the Medicare Advantage plans, it covers all Part A and Part B coverage services and supplies. May also cover things that are not covered by original Medicare, like vision and dental coverage. Most Medicare Advantage plans include Medicare drug coverage. You must have Part A and Part B for both Medigap policies and Medicare Advantage plans. And you do pay a premium under the Medigap policies. You pay a premium for the policy and you pay the Part B premium. For Medicare Advantage plans, you also do have a premium, and in most cases, you pay the premium for the plan and you pay the Part B premium. So Medicare drug coverage, which is Part D, this is an optional benefit available to people with Medicare. It's run by private companies that contract with Medicare, and it's provided through Medicare drug plans, also known as PDPs, and work with original Medicare Advantage plans with drug coverage, also known as MAPDs, and then some other Medicare health plans. So how Part D works, if you join late, you need to remember that you may have a lifetime penalty if you join late. It is optional. You can choose a plan and join. You may pay a lifetime penalty again if you join late. Plans have formularies, which are a list of covered drugs, which must include range of drugs in each category, are subject to change, and you'll be notified of that fact. Your out-of-pocket costs may be less if you use a preferred pharmacy. If you have limited income resources, you may get extra help. The Medicare drug plan costs what you pay. Most people will pay a monthly premium, and it varies by plan and income, a yearly deductible, if it is applicable, co-payments or co-insurance, out-of-pocket costs, a percentage of the cost while in the coverage gap, which begins at $4,660 for out-of-pocket spending in 2023. Very little after spending $7,400 out-of-pocket in 2023 will automatically get catastrophic coverage. Choosing a Part D plan, again, call 1-800-Medicare, compare plans by computer or phone, find health and drug plans at medicare.gov /plan compare. You can call Medicare. You can contact your SHIP at shiphelp.org for help comparing plans. And that's a wonderful resource because they actually will do a deep dive with you. And they have all the information as it comes from a Medicare. And so that's a great resource to use when wanting to get in and figure out what's the best choice for you. To join a Medicare drug plan, you can enroll at medicare.gov, of course, plan compare, or on the plan's website. You can call Medicare, enroll on the plan's website, or call the plan, complete a paper enrollment form also, and the plan will notify you whether it has accepted or denied your application. For Part D late enrollment penalties, you may have to pay more if you wait to enroll unless you have credible drug coverage, extra help. You'll pay the penalty for as long as you have coverage. So that's as long as you are covered. It's 1% for each full month eligible without credible drug coverage, and then multiply the percentage by base beneficiary premium of $32.74. And this amount changes every year. Help for people with limited income and resources is available. Medicare savings programs, extra help, Medicaid, and then the Children's Health Insurance Program, or CHIP. And what is extra help? It's a program to help people pay for Medicare drug costs like Part D, also called the Low Income Subsidy, which is LIS. If you have the lowest income and resources, you pay no premiums or deductible and small or no co-payments. If you have slightly higher income and resources, you pay reduced deductible and a little more out of pocket. If you have no coverage gap or no coverage gap or late enrollment penalty if you qualify for extra help. And please note, a special enrollment period allows you to change your Medicare drug plan, also known as PDP, once per quarter in the first 3 quarters of the year. And qualifying for extra help, you automatically can qualify for extra help if you get full Medicaid coverage, supplemental security income, or SSI, help from Medicaid paying your Medicare premiums, Medicare savings program, sometimes called partial dual. If you don't automatically qualify, you must apply online at ssa.gov/benefits/Medicare/prescription help, or call Social Security at 1-800-772-1213 and ask for application help with Medicare prescription drug plan costs. So here are some helpful websites, and these are very helpful. Again, for Medicare, Medicare.gov; for Medicaid, Medicaid.gov; for Social Security, SSA.gov; for the Health Insurance Marketplace, Healthcare.gov; Children's Health Insurance Program, InsureKidsNow.gov; the CMS National Training Program, and that's the CMS National Training Program.cms.gov. And then the State Health Insurance Program, or SHIP, is shiphelp.org. And lastly, I just want to take this time and thank you guys for attending this session with CMS. We so appreciate your time. We are always trying to improve our level of service to our customers and stakeholders. And so you can help us do that by providing your feedback on today's session entitled CMS KC Medicare Basics FEB Pre-Retirement Seminar. Just take a few moments to complete the brief evaluation. And we also have the code here. And I just want to thank you so much for being present and attending today.
Thank you so much, Rory. That was great information. John, are you able to open up the chat for everyone? I'm not sure if he stepped away. Until the chat is open for everyone, I believe that you can go ahead and there we go. We started getting the questions in. Okay, perfect. So our first question is, how does Medicare work with our federal retirement health benefit? Are we required to sign up for Medicare and our FEHB plan? Does that help with Medicare that doesn't pay, or are we required to sign up for Medicare since we have group plan coverage?
You are required to sign up at least for Part A. Because you don't want to face any penalties. And once you do, what you would do is just contact them. You would tell them that you're reaching that age, even if you're continuing to work at that point. But you definitely want to contact Medicare, let them know that you are going to sign up for this, but you still have your group plan. And then they would be able to help you to determine what needs to happen, or what if you need to, somehow orchestrate your coverage based on what you have and then what we need to do. But I do know that you definitely need to contact, if you're heading towards 65, you want to contact them and at least do the Part A. You can always opt out of Part B, but you want to opt out, just at least notify them.
All right. When a federal employee retires, I heard they can continue their government health insurance. Is this true? I think you just answered this one essentially with the question there. All right. So are these slides on the main documents page now? They should be on the main page. We uploaded those, I believe, this week. So check those out. Are Puerto Rico and other U.S. territories considered part of the U.S. when determining Medicare eligibility?
Puerto Rico is a part, yes.
Okay. How does Medicare work with TRICARE Prime?
Ooh, that's a good question. I would say that it's going to work the same way. You want to just contact them, let them know that you have TRICARE. But so you want to, again, sign up for Part A because that is the part that you wouldn't even have to pay for. But you would be able to find out exactly how it would work together. Again, just once you contact us and they kind of go in depth and find out what your coverage is. I'm certain that no matter what type of coverage that you have, you want to notify Medicare and take Part A because you don't have to pay for it. Now, if you did have to pay for it, then, that would be a discussion because you don't, want to pay for something if it's covered. But I think they do work in tandem together. No matter what type of coverage that you have, it's just the fact that you want to notify them so that there's no penalties involved later or any time in the process.
All right. How is the donut hole calculated in terms of cost and when it begins and ends in a given year? Okay,
so now we're going deep. That is one that I would have to find out for you. It's a great question. I do know about the donut hole. I don't know the calculation and how all of that is actually done, but I will definitely find out and answer that question for you.
All right. And what is lifetime reserve?
Oh, lifetime reserve. That is another one that I don't want to misrepresent because I have in my mind what I'm thinking it is, but I want to find out exactly and give that definition for you. So I will be able to do that for you today. And hopefully that will be posted on the website for you.
All right. You stated some are automatically enrolled in Medicare. Who is and who isn't automatically enrolled?
I think it did go over who's actually automatically enrolled. I think those are people who are typically, I want to say, I would have to find out because I want to say the people who are railroad or Medicaid, if they lose their Medicaid. But again, this is another one that I want to make sure that I cover all the bases. And so I'll find out exactly who's automatically enrolled, because the way that I can see where that's confusing, because a lot of times we're always saying that you must contact Medicare to make sure that you opt out for if you don't want to take it, or you're hitting that 65 age range. So that's another one that I'll definitely find out for you.
All right, thank you. So there are a lot of more questions in the chat. So if you might be able to stick around and provide some of those answers, I want to go ahead and take a break for everyone because we'll be going to our next speaker here shortly. So thank you so much, Rory, for being here today and providing this information. So we will take a break until 10 a.m. Central Time. So we'll go ahead and go on break. But Rory will stick around. I was looking at Jackie's, Waters Jackie's email there. Rory will stick around and answer some of these questions in the chat. And again, we'll post those Q&A on the website after we get all of the responses. So thank you so much, Rory. We really appreciate your time today.
No problem. No problem. Thank you.
All right.